Hello everyone. How's everybody? Okay. um I'm going to talk about adaptive biotechnologies today. Ticker ADPT. I talked about this company before, but I want to bring it back to your attention because sometimes I like to do that with stocks that are, you know, not talked about that much. This company is really good. It has a really high ceiling. The growth for this company is, I don't know what the word is, but it's high. It's trading right now, as I do the video, at $8.66 off its 52-week high of $40. And the 1-year target is $15.30. Institutional ownership is 87%. Market cap of $1 billion. And this company has collaborations with Genentech and Microsoft. So Microsoft, that's key to what they do. Let me get up. Let me get something here. Hold on one sec. Alright, so let me describe to you what they do. ADPT. What they do. Your immune system is made up of two parts, innate and adaptive. The innate immune system is present at birth and provides basic recognition of threats. The adaptive immune system builds throughout your life as you encounter new threats, such as a virus, and retains past encounters in memory. It's an impressive and complicated molecular machine. As its name implies, Adaptive Biotechnologies is building a technology platform to leverage the adaptive immune system to diagnose and treat disease. And this is from The Street, so via The Street. Just want to give this credit to them. A key company effort is translating how genetic sequences that govern the immune system determine the functions of antibodies, T cells, and B cells. T cells and B cells are the first line of defense in the adaptive immune system. This could lead to development of ultra-sensitive diagnostic tests and precision cell therapies. It's an ambitious approach to medicine. Your immune system contains more than 100 million unique antibodies and can generate over 1 quadrillion. That's unique immune receptors. I'm going to repeat that. And your immune system contains more than 100 million unique antibodies and can generate over 1 quadrillion unique immune receptors. That's why Adaptive forged a collaboration with Microsoft, like I said before. To help crunch the data, the duo leverages the Azure cloud computing platform to build maps of the immune system. They're characterized 58 billion receptors to date. The Microsoft Adaptive Partnership. The coronavirus pandemic proved to be a perfect validation for the partnership. Adaptive and the software and cloud giant worked together to understand human immune responses to the SARS-CoV-2 virus from 9,000 global patient samples. That effort generated a map of more than 160,000 T-cell receptors that bind to the virus, which led to a unique diagnostic product called T-Detect COVID. Unlike diagnostic tests that detect antibodies that neutralize the virus, T-Detect COVID is the first and only diagnostic product that identifies T cells. Why is that important? Antibody levels decline over time, but that's not very meaningful because protective immunity is driven by B cells and T cells. Your body may stop producing neutralizing antibodies, but it retains memory of the virus through T cells for months or years longer. Studies demonstrated that T-Detect COVID could determine prior infection in 97% of individuals 2 months after infection, compared with 77% for the best performing antibody test. In some patients, it detected prior infection as long as 12 months after infection. The blood-based test was 100% accurate in determining negative results. More impressive, the T-cell diagnostic is refined to the point that it can distinguish whether a person received immunity from a prior infection or from a vaccine. The first of its kind COVID test wasn't a big commercial success out of the gate, selling about 30,000 units in 2021. But the T-Detect platform will expand well beyond viral infections and into a total market opportunity. The company estimates at as much as $18 billion. Will T-Detect Lyme hit a bullseye? The second and newest product in the T-Detect lineup can be used to diagnose Lyme disease, specifically by detecting T cells triggered by the bacteria that causes the illness. The test can accurately diagnose 54% of individuals who develop a characteristic bullseye rash or other nondescript symptoms, compared with only 30% for standard antibody tests. When used in the first 4 days after symptoms appear, T-Detect Lyme correctly diagnosed 44% of individuals compared with 14% for the standard diagnostic. Individuals who are treated sooner have better outcomes. Adaptive Biotechnologies estimates that in the U.S., 3.4 million tests to diagnose Lyme disease are performed each year. Of those, its market opportunity is some 600,000 patients. The improvement over standard of care could provide the platform with a commercial and competitive advantage. If the tests become part of a primary care, it could further cement T-Detect's place in medicine. The company's next goal is to develop T-Detect products that can distinguish and diagnose 5 separate autoimmune disorders: Crohn's disease, multiple sclerosis, celiac disease, ulcerative colitis, and rheumatoid arthritis. This is where most of the estimated $18 billion market opportunity resides. For these diseases, diagnosis options are poor or unavailable, so patients who develop symptoms might not be accurately diagnosed for as long as 5 years. This situation is ripe for improvement. Importantly, all T-Detect diagnosis will leverage the same infrastructure, some of which was built for the COVID test. The platform has the potential to scale relatively quickly. The success of the T-Detect portfolio will play a crucial role in determining the success of Adaptive Biotechnologies. While the business also has blood cancer diagnostics and drug discovery partnerships, mass market diagnostics that address key pain points in early detection represent a unique opportunity to achieve wide profit margins at meaningful scale. Execution will be a focus of investors. The company reported an operating loss of $209 million for 2021. So they have a revenue of $154 million. They grossed $91 million. They're not profitable. They have $363 million in cash, only $113 million in debt. Revenue has grown since 2018 to 2021, each annually. And let's see, their earnings per share. They beat earnings in the last 4 quarters. So that's why I wanted to give you another video on this company, because that article was very telling by The Street. It's very telling. This company has unique capabilities with its partnership with Microsoft and for diagnosing and all that. So just keep this on your radar. That's all I got. So have a great day, everybody. Bye-bye.